All right, welcome back to the Pure Playbook podcast. I'm Dr. Dustin Bosson here with the Dr. Nate Merhaut. And this episode is going to be all about how we are able to bring student athletes and, well, athletes in general now, professionals in the building too. That's pretty cool. But how we're bringing back athletes faster from injury, morally, ethically, clinically. So if that's something that intrigues you, which most parents of student athletes and student athletes yourself and athletes of all kinds are probably super interested in, that's what we're going to be covering today. We're going to give some tips and tricks behind the scenes on what we do, how we're able to analyze, what data we're using, and how we're able to bring these athletes back faster. We could go on a long rant of why that's so important, you know, the mental, the physical, the relationship. We can go down all that, but literally we're just going to talk about a couple different, not even just about the athletes themselves, but a couple different injuries, but more so listen to clinically how we're starting to approach this and how we're able to bring these athletes faster, because what we're hearing on the feedback side is this is exactly what we've been looking for. Why hasn't this happened sooner? Which is very humbling to hear. So, and here's the thing, it's like this whole podcast is all about, you know, pushing the mission of the Pure Athlete, the healthcare facility, to be able to serve more student athletes and their parents, trying to keep up, and giving them answers to where do we go, who do we trust, how do we prevent, and giving them those resources and building that community so you guys know where to go and you know things are being taken care of properly and you have all the diagnostics and all of the research backed, the science backed, but also the clinical experience of we do this day in and day out. So let us kind of change the dynamic of what's happening in the sports med world, returning athletes to play faster and returning them to their sport. So with that being said, make sure you follow, like the podcast, everything on the social medias. There is the Pure Playbook that's a standalone on Instagram and Facebook, but the Pure Athlete is also the bigger part of that umbrella. So follow us on social media. Let us know. Put some comments throughout. Let's engage. Let us know what else you need to hear about. Let us be a resource for you. So without any further ado, I'm going to continue to jabber on here a little bit just to kind of set the stage, because, I mean, we talked about it just a minute ago, but even this morning, seeing 3 or 4 sprained ankles in, you know, a knee, we've got hamstrings, we've got, you know, if there's an injury, a very common injury, one of the top 5 injuries, chances are it's in here. And this morning, it feels like we went through all of them.
Right.
So we've got everything from a high ankle sprain that we've brought back within 10 days. 10 days or less. I think it was more like 8 or 9 days. That was a soccer injury, full high ankle sprain, rolled it over, big cantaloupe hanging off the side of the ankle, was not fractured. We also had a similar injury that was fractured, was only in a cast for 2 weeks. That is unheard of. There's a reason for that. Talking about even a shoulder injury that's like, okay, we're progressing that back faster as well. Shoot, what else is there? Dancer with hamstring injury, returned her back. We've got right now in dance world, it's a lot of recitals, a lot of competitions, and going right into the nationals. And it's like, imagine having an injury during a peak time, or even some of the end of high school baseball season, or track, and you lose a hamstring, or you start to have a tightness in a hamstring or a quad. All of those stories have been in here recently, and returning them to play faster, which a lot of times, here's what you guys hear, correct me if I'm wrong, but almost any injury you go in for, it's 4 to 6 weeks. Most often you rip off an ankle and it's like, man, 4 to 6 weeks, we'll try to get you back sooner. And it's very piecemealed, watch and wait. So going through a little bit of that in this episode as well. But the whole motive is to keep these athletes on the field between the lines as morally, ethically, and clinical as possible. And I always put those in it, because we're not just saying like, oh yeah, we can write you the note, don't worry about what they say, we'll clear you. That's not the point. We are talking about safety of these athletes, but also the mental safety of these athletes, and giving you parents the care that is not dictated by something else, but it's truly about, if we can bring them back faster, morally, ethically, clinically, we're going to do that for multiple reasons. And that's what everybody wants anyway.
Right.
So it's been an honor to do that in this community. It's been enlightening for a lot of parents, a lot of coaches. We're starting to have more referrals from baseball coaches, from dance studios, from other parents. We've got our really cool metal business cards. If you haven't seen those, if you haven't gotten one and you're a patient here, get one, because they're super cool. But it leads them into a direct portal where they can directly book appointments with us, so we can have these things happen faster for you guys. So listen in as we go through some of this. Dr. Nate,
Yeah.
where you want to go?
With this, I do want to have a little disclaimer because this episode is on returning athletes faster. But in the same sentence, we also want to discuss that there are times during that returning them back faster where there are limitations that we're giving.
Yeah.
So it doesn't just mean that, in 2 weeks you're back to 100%. There's, like he was saying, the ethical guided return to sport where there might be some limitations as you're getting back to things. As opposed to just, you're out for 4 to 6 weeks and then at that 4 to 6 week mark, you're back in it at 100% when you really shouldn't have been.
Mm-hmm.
So part of it is an art of getting you back and returning you to sport gradually with some of the protocols, techniques, and treatments that we're doing here in the office, which help accelerate that process. But there are times where the return to sport based on if it's a fracture, there's other things within the injury, if it's more complex, where we can't get you back faster. So that is the reality of it. Sometimes that's the conversation that we have to have with these athletes. And then we run into scenarios too where we're trying to get athletes back faster, but if they're not going to listen to what we tell them, then it can set them back and be a longer recovery. And we've dealt with that too. So yes, we're trying to get you back faster. There are certain things that we are doing to do that. We'll discuss that during this podcast, but you have to listen to what we're saying, and you have to trust the process and the guidance that we're giving you if you want to get back faster than the average person. We can't always guarantee that, but with what we're using, the techniques that we're doing, the collaborations that we're having with other providers, professionals within the community, it's happening with the majority of our athletes in the office. So it's really cool to see that, and having the trust both with the parents, the athletes, and outside providers and professionals. We're starting to change the game on how people are returning to sport from a safe, effective way. And then when they get back to sport, tackling it from the preventative side so it doesn't happen over and over again. So go ahead.
So just to paint a little picture here is we could briefly set the foundation of more of the traditional timeline. And I've kind of already alluded to it.
Right.
Almost any injury you look at, I mean, unless it's just, I tweaked it, it's kind of a day-to-day thing. But you roll an ankle, say it's, pretty good case of, patellar tendonitis, or maybe there's AC joint impingement or some sort of separated shoulder, or, whatever the case might be. I mean, it's basically 4 weeks is minimum, and it's all pretty well. We talk about protocols a lot here, and it's like, okay, what are we, as we're creating protocols, we're being very cognizant of how we're creating protocols. It's like, here's the template, where a lot of times I think what we've fallen into, and I think most would agree, in my opinion, is, okay, if XYZ comes in and that's actually what it is, this is just it. And every athlete is different. Every person in scenario is different. While the diagnosis might be the overarching diagnosis, what all is actually involved. So when we go through this, it's very much not piecemealed. I think a lot of that, of what I was just speaking of, the status quo, is very much watch and wait, or, kind of piecemealed. And we've talked about that even with our general clientele, where it's just like, okay, we're not trying to do too much too fast, and we're not just going to throw everything at it we can because we have it here. However, we'll do this, and 2 weeks later we'll recheck, and it's like, no, we're very dynamic here in evaluating visit by visit what the expectation currently is, because there is the casting was a different scenario with the broken foot, but we had collaborated with a provider who understood, felt comfortable with what we're doing. And this girl's out in 2 weeks out of a hard cast. So we can start navigating everything around that. In this case, it was a foot, the ankle, the calf, the Achilles, the hip, the knee. Right. And we were actively able to start, which now she's already 3 to 4 weeks ahead of the terminal side of when she was supposed to be. Like, we're looking at middle of July. And so we're 4.5 weeks into this sucker, and she's already staring down returning to play at the end of the month for a national event, and then goes right into tryouts for a team that she's trying to level up in. Imagine sustaining some sort of injury, whether it's a break or whatever, and okay, 2 weeks, 2 weeks. All of a sudden, school starts in August. This happened in April. I was still in school. We're past all of those landmarks. And in the summertime, there's a lot of travel ball, we'll say.
Right.
And so not being able to return to the most important time of what you perceive as the most important time of the season is huge. So now imagine cutting that time down 20, 30, 40, and then sometimes 50%
Right.
to return for some of those things.
So to paint the picture on that story, pretty much what happened, there was a fracture, ankle sprain. So we dealt with the sprain strain injury as well as a fracture at the site of the fifth metatarsal. Spiral fracture, so a little bit more complex than some other types of fractures. She was put in a boot. If she would have gone, let's just say the traditional route, just for simple terms, if she would have gone the traditional route, gone to an ortho, gotten casted, she would have been in that cast for about 4 to 6 weeks. She wouldn't have had a follow-up with the ortho until about that 4 to 6 week mark to determine if she needed to be out of that. So one, with the collaboration with us, one, she was already under care. So we kind of was able to coach her on, let's see if we can start to do this a little sooner. Let's talk with the ortho, see what their mindset is, where they are with things. And we were able to get her out of the cast faster into a walking boot so that we could implement some of the other things from a soft tissue healing standpoint once the callus formation was there, and we were pretty much safe and good to go to progressively start loading it, and not just full 100%, start running and jumping and all that, because we're just now starting to get into that. But that already took about 2 to 4 weeks off of the care plan, or got us 2 to 4 weeks ahead is what I should say, because we were able to implement things faster. And then even as we started implementing the soft tissue rehab protocol of what you would typically do for an ankle sprain, and this was between a grade 2 to grade 3. We didn't necessarily get the extra ultrasound or MRI after the fracture was calloused over, because it didn't necessarily change the treatment plan from there, but it was a grade 2 or 3 and because of all the swelling and bruising pattern and some of the laxity that we noticed originally. But we were able to stay ahead of the game with it. And that, along with some of the tissue regenerative therapy that we were able to do, help with speed up the healing process of the fracture site, as well as some of the soft tissue that was damaged. But that's a little bit of insight on how, one, we were able to get out of the cast faster, as well as progress into the rehab protocols and move her through that faster than the average person would have. But like I said, if she would have gone through the general ortho route, she wouldn't have even looked at some of the rehab stuff until about that 4 to 6 week mark. And at that point, we would have been dealing with a lot of atrophy, which there's still a little bit of atrophy, but not as much as there could have been, because now she's loading it faster than what the average case would have.
And so we're already looking at, as we go through our evaluation, and so very much not piecemealed, and we have an extensive evaluation that we use that you should be getting, and it has more to do with than just the site of the injury. But we're already looking at, like you were alluding to, the end game of what this typically looks like. Is it's like, okay, it's 4 to 6 weeks, and then you start this. It's like, hang on a second. There's situations, a lot of situations, honestly, that not everything is a displaced fracture with a leg that looks like an S or an arm that's all contorted and, bent different ways and needs pins and surgeries. And like, that's a whole different deal. Most athletic injuries, while they are non-contact, they're not always the extreme scenario. However, we're put in this box of this is status quo. And we here are already thinking, okay, it's not the injury site that's going to keep you from playing back on the field, the court, the floor, whatever, the pool, whatever the case is, whatever sport you're in or what you're playing. And this goes for real life too. So, but we'll keep it on the athlete realm. So, but we're already thinking of, okay, if X, Y, and Z is this, we can already start appropriately limiting the atrophy, training everything around the injury so that you don't lose the time functionally, which is typically the hardest part of the injury. You break an arm, you're in the cast, you can't do anything, all that atrophy, you lose strength, you lose coordination, you lose mental effect as well of being out. And if we can start combating all of those things sooner, again, morally, ethically, clinically, and we have the relationships and the trust of the parents and the evaluation that we've done and in each other and what we do here, we can exude demanding that same trust from other orthos, from other healthcare providers, where this isn't a tiered thing of, well, he's the ortho, you're the chiropractor, or you saw them first and then you sent it. It's not, it's no, this is a collaboration of, it doesn't matter which door they walk into first. If you end up here in a facility like this, you start to get the end game as a part of the evaluation for the injury care. And we build it based on that instead of like, okay, well, now that we're here, now we can start getting you returned to sport. Mm-hmm. If we can do it all at once, we're going to do it all at once. So yes, the broken, and we've talked about this in a multiple podcast. There's another injury that wasn't a fracture. Same thing. We're staring down state cup soccer. She rolls her ankle. We bring her back in 8 days, doing a lot of other things. The Rice method is out. There is more that we do here outside of that and how we consult depending on the injury. We're not saying ice is bad. We're not saying Rice is bad. It's just changing. That's all you've heard for so long, and we've got to start looking at it differently.
Right.
Is there any more or less ankle sprains right now? Is there any more or less knee injuries right now? Is there any more or less hip or shoulder? They're all going up.
Yeah.
Are they returning to play any faster? Is there anything changing on the recovery side? Is there anything changing on the return to sport? Timeline-wise? No, it's pretty much the same. So at what point in time do we start to look at this a little differently? And if that's what you desire, that's what this is all about, because it's a multi-factored approach right from the get with end game in mind that keeps these athletes and these parents and these coaches exactly in the loop and exactly where they need to be as fast as possible to return.
Yeah. Part of that also comes down to, with getting the athlete back faster, is one, proper diagnosis. And we talk about that all the time, is if you don't have the right diagnosis to begin with, then one, you're going down the wrong pathway from a treatment standpoint. So if we can diagnose properly on day one, then we know what the game plan is. And a perfect example of this, which give them some leeway because I'll explain why, but athlete came in the other day, ankle sprain again, and they went to urgent care, got an x-ray. At the urgent care, they were unsure if it was a fracture or not. So they did put him in a boot. Mom wanted to go somewhere else, so they ended up going to an ortho. And ortho, again, looked at the images that were taken at urgent care, said kind of the same thing, was a little inconclusive on what was going on. Sometimes soft tissue swelling plays a role in what images will look like, as well as if it's a kind of hairline, or in this case, it was what we call a green stick fracture. That sometimes doesn't show up on day one. It takes a little bit of time on x-ray for it to show up, sometimes a couple days, sometimes a week or two before you actually start to see, oh yeah, actually there was a fracture. So nothing wrong on what they did so far, but then they, again, were looking for some more answers and getting back faster. And in his scenario, the injury that he sustained was about a 4 to 6 weeks, sometimes 8 weeks out. And he's in the middle of summer ball and it's 6 weeks. So it's like, okay, he's either missing summer ball, or is there a way that we can get him back and play maybe the last 3 weeks, kind of a thing. And that's where we are with it. One, we were able to diagnose it correctly. We took x-rays, did see the green stick fracture in the fibula. Good news for him, fibula is non-weight bearing. So that helps out in the scenario where we can do some things. The good news is the ortho that they went to did put him in the proper boot, whereas the first urgent care, unfortunately, it was not the proper boot. So even that alone, if you're going to boot it right.
Use the correct one, not the most expensive one.
So that there's that. But a cool thing where we were able to implement what we wanted to implement that day, and he walked into the office in the boot at a 7 out of 10 pain. And after we implemented some of our treatments that day, he was able to say it was a 1 out of 10 on the way out. So that alone is a drastic change. I don't think they were expecting that much of a drastic change. He came back in today, a day later, and swelling and everything looked really, really good. So we are careful with what we do when there are scenarios like that. When we're dealing with a fracture, we have to know what kind of fracture it is and how it's supposed to heal, what you're allowed to do with certain fractures. Does it need to be casted? Does it need to be booted? Is it non-weight bearing? Are there scenarios where it can be weight bearing, where it's a walking boot? All those kind of things. So those are all things that we're discussing with parents. Those are all things we're discussing with orthos and everybody else that's involved in the case, to make sure everybody's on the same page and they know what they're allowed to do, what they're not allowed to do each day and as the week progresses. And then as we progress the rehab program, as well as the structural component of it, which 99% of our athletes are getting that part of it too. We uncover some things that they didn't realize were going to be underlying on why this injury happened in the first place. If it wasn't some type of catastrophic or freak accident injury, there's usually that structural component that's underlying that we'll address as well. The other thing that we will implement as fast as possible when we're dealing with soft tissue injuries, especially joint injuries and the soft tissue around those, is can we get proprioception back as soon as possible?
Mm-hmm.
Because that is oftentimes a thing that with rehab programs is missed, and why a lot of these injuries will reoccur.
Mm-hmm.
Because once you damage some of those tissues, whether it's the joint or the ligaments, the tendons, they all have little receptors in them. We need to either have other areas of the body act as that if those receptors are damaged, or reprogram that so that they can come back and actually know where those joints and those muscles and ligaments and tendons are in space when they're moving. So that's a big part of it.
And so before you go down that route, let's I kind of want to summarize. Okay, the traditional recovery scenario is something that is that needs to be more on the limelight, that of change, of updated updated protocols, we'll say, because the thing with the traditional side of what we've been doing for however long, 50 plus years, probably at least, is the long recovery windows.
Yep.
And for whatever reason that is, I think in most injury cases now, I mean, I remember when, ACLs were more than a year, and then they're, just over a year, and then, they're 14 months, then they're 12 months, then they're 9 months. And it's like, okay, those things are continually getting shorter, and whether it's ankle sprain, elbows, tennis elbow, golfer's elbow, whatever the case is, I think a lot of the recovery time is just such long windows. And like you said, if it's a 6-week summer ball program, you're missing half, if not all of it, right off the bat. Bang, right. Game one, you step on a bat, you roll your ankle, you break your foot, it's like, holy cow. How do we bring those back faster? It's also fragmented. The care is very much fragmented and piecemealed, like we said, where it's like, okay, watch and wait, or it's, maybe one or two things at a time, or maybe it's, okay, we'll go to PT first, or you get the run of the mill. It's fragmented, and that's the expectation that insurance companies have set in order for you to have care covered, and which is a whole nother deal. But one thing I've started saying is don't let somebody else who doesn't feed your kids decide what care they get to have. If they don't feed them, they don't get to decide the care they have. You ultimately do. So just know, because that is something common that comes up. We are out of network with insurance for that reason. And this isn't an insurance rant, but I'm going to explain to you why. Because a lot of times, and I'm so grateful to see these parents really change their mind because of the evaluation process they do. They're like, oh, that makes so much sense. And we tell them, we're not going to let anything else or anyone else dictate the care that you want, need, and deserve to get them back on the field faster. You don't have to take us up on what we do here, but here's why we do what we do here. So if they don't feed them, they don't get to have a say in them. Okay. And so just keep that in mind it definitely is out of status quo with what we do here. So, but what that also gives us the ability to do is, people don't get hit with bill in the mail. We're not tied to the care that, okay, well, we can't get an MRI yet. Well, why not? We want to see because we've got to do a trial of care first, and then we've got to go through PT, and then we've got to go to a return visit, and then we've got to submit up. It's like, holy cow. Here, you get it done. We have digital x-ray. We've got direct, we're working on getting ultrasound in-house. That's one of our goals here. But right now we have an ortho that is very good at doing that, and we partner with them to do that. We've got, the break that we had even this weekend, had a young girl break her arm in a soccer game. Boom, referred her out to there. But it's no longer fragmented, which is what it is before. One doctor will decide, no, this is not fragmented anymore. But also, you miss the root cause of the diagnosis. Is it's like, okay, you sprained your ankle. It's like, okay, was there something else going on? Is there anything else going on? A lot of times we're looking at the site of injury, which, if you've listened to any of what we have talked about, oftentimes is not the source of the injury. The site and the source of the injury can be two different things. Very much can. You step on a bat, you roll an ankle, different story. We'll call that contact. Okay. Right. But most of these things is, it's like, okay, the defender came, she tried to ball roll, boom, took a step, rolled the ankle, took out the knee, through a pitch, whatever it is it's the site of injury isn't always the cause of injury. And that's what makes us a lot different, and also able to get these athletes back faster, because heaven forbid they go back out, they're cleared, and then they re-injure it. So that's also something that we're thinking on the front end, which is not the traditional side of what we do. It's very reactive, not preventative. And if we have to be reactive and we see people first here on an injury, we're already thinking of, okay, how do we bulletproof this going forward? And we incorporate that into the injury care. And then there is life after injury care to bulletproof it going forward. That alone makes us a lot different.
Yeah.
So multi-system approach, we stack protocols with a lot of different things that we have available in the office. So like you were starting to say, even, looking at things like proprioception, looking at things like the mental health side of it, looking at things, we have digital x-ray, we have technology to take in data directly off of these athletes. There's so many things that we're looking at to provide a protocol that is extensive and multifaceted so that we can find it, fix it, and get you back faster as quickly as possible.
Mm-hmm. Yeah, even within that protocol, like you were saying, from the diagnostic standpoint, the site of injury is not always where the issue is. So we're including in the treatment plan areas unrelated to the layperson to the site of injury. Mm-hmm. So if you come in with a low back pain and we're looking at hip, knees, and ankles, there's a reason for that.
Yeah.
And you're going to be doing stuff for probably hips, knees, and ankles if it's a low back issue, because there's probably an underlying thing that's going on there, as well as when we take the x-rays, let alone the structural issues that we're going to see that every single time we take them, we're uncovering for these athletes. And a perfect example of that was this morning too, where it comes in with low back pain, somewhat reoccurrent, but this time around seemed to be the worst. And then after we were discussing, other things started to unravel, shoulder dislocations and all the other stuff. And there was a pretty severe scoliosis that we saw and found that they did not know about. The kid kind of started to know something was going on spinal related. And he said he was trying to bring it up to mom and dad, which even is a point to talk about that you can address. But the structural issues underlying and how they relate to what is happening with some of these acute type injuries that athletes are dealing with is a big piece of it. But do you want to touch on that part of it real quick?
Yeah, I can definitely do that. And one thing I'll prelude going into that is kind of an in-game result here, and I'll probably mention this again at the end, is a lot of these injuries, and this is why some of this needs to change. A lot of this needs to change is we're so focused on, again, not the actual root cause. And I think we're so conditioned, and even in this young man's case, it's, he stretches and he does this and he still doesn't have flexibility, and stretch and strengthen and mobilize. And again, we're back on this muscle journey. And I kind of get it, how it's like, okay, athletes, strong, fast, performance, muscle. It's all muscle related. Let me just encourage you guys this very boldly. If you take nothing else from this other than it's not a muscle problem, it's a structure problem. Chances are it is a structure problem. So what you're getting at here too, and we had a dancer start earlier this week. We've had 2 or 3 dancers start this week. We have a baseball player start this morning. We've had, and it's the same thing. And to watch these people's face, and I pulled us all in here this morning. We have a few appointments on the early end. 7 a.m. We're like, Dr. Nate goes, Santa's coming tomorrow. We had somebody scheduled at 7 a.m. It's like, oh man, here we go. We come in early, 2 hours early, 7 a.m. to, pretty intense low back pain. Can't swing a baseball bat. Having trouble throwing now, literally, can't really play. So, I mean, he's going to be benched, unfortunately. And he's like, I want to get this taken care of. And hasn't really had pain like this before. We start going through an evaluation. We lay him on the table. You start going through the ortho side of it, and just watching him lay on the table and looking at some things dynamically from my perspective, from a different angle. And I'm already seeing, it's like, okay. And you start pointing things out. And part of what we do in most of our evaluations are we have digital x-ray on site. It's like, okay, definitely taking films. It's covered in your evaluation. No big deal. Let's knock them out. Typically, this is where this particular appointment flipped on its head. We go back there. I'm taking films, and I've had an idea of what I thought I was going to see. It's like, okay, we're going to have some rotation lumbar spine with how it's acting, with the ortho tests that you've done. We're going to have AI sacrum. We're going to have, there's all of these things running through my head. And then we get into, as I go down, I flip him, start doing A to P views, take lumbar spine, and I see a bit of a curve in the lumbar spine. And I'm like, okay, more than I thought. 13, 14 degrees in the lumbar spine, 10's considered scoliosis, not a surgical emergency. It's just a label. It could have been 8 degrees and they could have decided to call it scoliosis. But, that 12, 13 degree range, yeah, it's a noticeable curve. Continue to go up, take the AP thoracic spine, and there's almost a 20-degree curve in the thoracic spine. Mm-hmm. Nobody knew. It's like, do you think that would change the dynamics and make you more injury prone on a lot of different facets, just having a curvature in the spine? And I think I could ask that question to most people. And if I showed them, be like, do you think this person would be more or less susceptible to any injury, shoulders, back, low back, neck, hips? Like, could you make sense of why this person would be more injury susceptible? I think most people would be like, yeah, I think they'd be more injury susceptible than this person. Okay, great. They had been to other doctors at bigger healthcare facilities. Nobody took any films for more of what seems to be actually more of a chronic low back issue that young man didn't necessarily know how to communicate. But what you were kind of getting at too is for you parents out there is it's not always like, oh, we'll suck it up, or, oh, we'll try the Tylenol and the Advil. Oh, like, because this young man too goes, well, I've been trying to tell them that. And I kind of had to slow his roll because as a dad now, right, it's, our parents always said, you wait till you have kids, you'll see things differently. And this is one of those times where it's like, I can hear my mom and dad in my head, you wait till you have kids, you'll understand, we feel terrible. But I told this kid, I told this young man, I said, look, I get it. And it's nobody's fault. You don't necessarily know how to communicate those things yet. And that's fine. I said, but let me tell you, I said, I saw your dad's head drop when he saw those films because he had no idea. He didn't know where to go, who to trust, and how to prevent it. He wasn't told by some people who should have probably taken the films already that we need to take films and diagnose this a little better. But for you parents out there, take nothing with a grain of salt, honestly, when it comes to these things, especially these athletes, when they start talking about something. My son did it too. I'm like, buddy, he just got glasses a few days ago. It's like, dude, why are you so close to the TV? And like, I knew, and it's like, sometimes they get excited and I'm like, I'm pretty sure he needs an eye exam. Yeah. And then weeks go by, those things go by, but it's like, he just didn't know how to communicate, or he thought he was in trouble. He's like, I don't want to tell him I don't want to see, or that I can't see. It's like, I don't know that they don't know what to do. But it's even in this young man's case. And I told him, I was like, look, I can see on your dad's face. And I was like, give him a little grace. They didn't know what they didn't know. Right. This is not the norm. Right. While it should be. And his dad's over here nodding like, and he works at this particular facility. And it's just like, we're not here to point fault at anybody. We're not, it's literally, it's just the status quo that they practice under. That's the view. That's the perspective. It's the reactive care, not the creative care. It's not the injury prevention. It's not I think every athlete, now they're going to 2-year physicals. It's like, that's asinine. Right. And the physical itself isn't even good enough because we have kids walking in here all the time that have sizable curves of their spine and nobody knows about it. If there was one thing that we were going to look at, I would say anybody who has a kid that plays sports, especially between the ages of 12 and 18, you need to have an evaluation done. You need to look at the structure because chances are that is the biggest thing. And for you parents out there, get it done sooner because those things can be, be careful saying fixed, but you can make progress with those things very, very quickly. Mm-hmm. And I'm not saying 100% straightening will happen. Can it? That's up to God, and we just remove the interference, and God and the body does the rest. Right. But matter does have limitations, and the longer it's there and goes unnoticed, or there is an injury and you don't decide to take care of it, or heaven forbid you find out when you're 28 that you have an 18-degree curve in your spine, you're managing, you're not fixing at that point. Right. That curve will be there.
Right. And with scoliosis, there's most of the time we're finding these cases when growth plates are still open because we work with a lot of student athletes, and that is an ideal time to start making change.
He was excited to hear that.
Just like you said, that change can happen. If nothing's done, that it can go in the wrong direction, and it can be worse. There are still cases where we're treating at the frequency that we recommend originally, and then we retake films, and either there's no change or it's actually looking worse. And then we have to switch gears, and that's why we also retake and monitor the progress throughout, because they might be growing at a rapid rate, and that curve is also growing at a rapid rate. And if we're not keeping up with it from a treatment standpoint, then we need to switch gears, maybe add a little bit more frequency and change what we're doing from a treatment standpoint. But first step is just knowing that it's there, and you don't know until you actually take those films and find that out. There have been many athletes that have come in here and they said they've gone through, the nurse protocol. You put your hands together, you do what we call Adam's test, where you reach down towards the floor and they look for a little bit of a rib hump as you're bending down. It's not always going to show up there, because one, you have to be trained the right way to look for those curves. It could be that rib hump could be in the thoracic spine. You could also have a little bit of a curve or a hump down in the lumbar spine. If the curve starts there, or you only have a curve in the lumbar spine, Adam's test isn't necessarily the best thing for that.
Yeah, this was a conversation I had with somebody yesterday. We both might have to privy up on this a little bit, but I remember a conversation of some of these tests. Oh, we were talking about PSA. Different men's health conversation. For you dads out there, if you have questions about PSA, let me know. We can talk about that. But we're not going to talk about that right here. But is the test is sensitive and or specific for a certain finding. And so it gets pretty tricky. This is one of the things where you really have to line it out in your head. And so I might get this wrong, but let me just allude to what that means. So Adam's test is specific for scoliosis, meaning that this test is for scoliosis. If this test is positive, they are saying you have scoliosis. However, and I might have it backwards. However, the sensitivity side means just because it's not positive doesn't mean it's not there. So the sensitivity of what Adam's test is exactly what you're talking about. And so I say that because it's a very good and easy example, because also with ortho tests for the ankle, or anterior drawer for ACL, or anterior posterior drawer for ACL, PCL, shoulder test, whatever it is, they might be specific to that area. But just because it's negative doesn't mean it's not there. So the sensitivity of the test you're doing has to be up to. And this is one of those scenarios where Adam's test, honestly, junk it. If you can't see inside the body, especially for something like scoliosis, there's no other better way. You want to talk about specific and sensitive, digital x-ray all day long right now, weight bearing, standing up, not lying down. What does the spine look like? You will know 110% of the time if there's scoliosis, not, lean down and they might be rotated.
Right.
So
that's also why we have layered our assessment and why we created the Pure Athlete evaluation. There's multiple things that we do within the evaluation, and there's a reason for that, because just doing one test, one orthopedic test, or just taking x-rays, or just doing a movement assessment, again, you're kind of piecemealing the evaluation. So putting it all together, and yes, there are things within the evaluation that hold more weight, but doing it all together makes it better from a diagnostic standpoint, where we can actually say, yes, this is what you're dealing with, and this is the protocol and the treatment that we're going to do for it. So putting it all together. And if you're not doing the evaluation, if you're coming in from an injury care standpoint, which you already alluded to, we build that kind of in on the back end, where you're going to get the Pure Athlete evaluation when you're able to do it, because it's going to give us so many more answers on maybe why this happened in the first place. If it wasn't some type of, someone ran into your knee and fell on it and it blew out the medial aspect of it. There's a reason why a lot of these injuries happen. And if we can get on top of that, unfortunately, if it's because you came in with an injury, then we're going to make you stronger and better afterwards, because we're going to do the evaluation and then build you and protect you after that.
Yeah, absolutely. So a little bit of the comeback blueprint as we head downhill here. So we talk about bulletproofing, and we have even some blueprints. I talk about house blueprints all the time. If you build your dream house, you got to look at the blueprints. And
here they're called purple prints.
Yeah, here they're called purple prints. Yes, but the evaluation is that has to be top notch, and it has to be. I always say 4-dimensional, if not 5-dimensional. So if we're only looking at one thing at a time, if we're going through the standard quo process, if you hear standard quo of these avenues that we're traditionally accustomed to, let your eyebrows raise a little bit, ask better questions, get better answers. But that's part of what we do, is the evaluation being top notch and so dynamic is what's going to give you the best answers, which now clinically helps us get you back faster. The other thing is it's literally, we do it every single day. The time and repetition and the things that we see every single day, this is what we do, which also clinically gives us the one experience, but two, it's kind of like specializing in something in a field. It's almost like becoming a dentist, and then there's like dentists, there's periodontist, and then orthodontist, which all have different training. So it's like you go to be a dentist, then all of a sudden it's like, you know what, I want to get into the braces game a little more, and so it's like, let me just go a little longer, or whatever we have to do to become an orthodontist. So it's not that that individual person's not a dentist, but what they do every day is orthodontics. And so, yes, we are family care physicians, and yes, we see a general clientele, but for you athletes, be careful you athletic families, be careful who you go to, because if it's somebody who doesn't do it every single day, chances are it's going to be more of a traditional approach, which I'm going to say is fine in a sense. I'm not going to say there's anything wrong with that. How about that? It just might not be the best approach for what it is you're actually looking for. And then having a multifaceted and multidimensional mode of treatment, if it's the tissue regenerative therapy we do, the structural, the adjustments in the chiropractic side, if it's the performance rehabilitation and even the training side of it, if it's the bulletproofing aspect, if the proprioception, the mental side, the dynamic multitasking, the concussion evals, there's just so much that we can now incorporate very specifically to each individual athlete. What happens afterwards? Like if you get somebody who's only trying to treat the injury, and it's like, okay, once we're past this, we'll get you back into, we'll clear you. And then if there's nothing after clearing, run quickly, or at least seek out. It's like, okay, well, we understand what they're saying, and if we let them oversee it, fine. But you need to actively start looking for something after the clearing point. Because that's where really the most advantageous part of the whole entire care plan is. So if we're only dealing with injury and we're not bulletproofing against the next time, almost any injury you see, I mean, you're going to have a 40 to 60% recurring injury rate. It's like you hear all these athletes spraining ankles, or I got patellar tendonitis again, I got shin splints again, my shoulder hurts again, I've got tennis elbow again. Right. If we're only talking about the time frame of the injury, we're not talking about the right things. So that also gives us an advantage in making sure that you guys know what's going on, but also how we get them back faster and how we keep them there. And so also I'm going to challenge you athletes and your parents is, do not take that care plan to heart. Take the extra steps, because everybody's busy. It's time, it's money, it's effort, it's, schedules, it's 4 kids, it's 18 sports, it's travel, it's, I get it. However, do not let the traditional approach be your end game. And really, please, 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 for these kids' sake and your financial and time sake, put a little more effort in. Find that time now to be able to continue that care plan after, because it will tenfold return to you in time, effort, community, money, whatever you want to look at, in the headspace of these kids and these teams and their future. If they do want to go play other sports, there's just so much more. Do not sleep on the aftercare of the injury.
Right. I would even say along that point, if you're put in a cast, if you're put in a boot, if they're telling you to brace it, then one, sometimes there's a time and place for that. Okay. 2, there's tons of stuff that can be done during that time frame if there is necessary casting, if there is a necessary boot, just like we were talking with some of our athletes. There are things that can be done, one from a tissue regenerative standpoint, as well as preventing and reducing the amount of atrophy if you're in a cast or a boot or immobilized. There's all the other areas of the body that gives us an opportunity to focus on some of those other areas where there's deficits that might have led to the injury in the first place. That why don't we attack that now until we can get to the site of fracture or injury, because it's an boot or a cast. And then also on the back end of that, if your prevention protocol is to wear an ankle brace or some type of brace, or slip a knee sleeve on or something like that, if that's your prevention protocol and that's what you're doing to prevent something from happening again, also the wrong thing.
Yeah.
There is, again, a time and a place for certain scenarios where those things are necessary. Perfect example of that is NFL linemen, where they're putting braces on their knees from a preventative standpoint. Yes, that is okay. Those guys are strong and they have everything that they need from a muscle and performance standpoint. They can wear a brace.
Mm-hmm.
There's a reason why they're doing that.
And also, I mean, they're around a bunch of other 450-pound sweaty ass dudes that are slipping and sliding like wild pigs that are oiled down, and it's like at any point in time you can take a blow.
Right.
Absolutely.
So with research and what is shown, from the most common injuries, and is there's something that can help prevent that? If a brace is in that conversation for that prevention, then yes. But don't be putting ankle braces on both sides because you sprained the one and we want to prevent the other one from happening. There is so much more that we can do on the preventative side that we are, I would argue, the best in the business at doing, and the protocols that we can put in place for you for that. So don't get stuck in a brace.
Yeah. Yeah. And I guess that's kind of what we'll start to close with is, okay, let me point some things out of why you would need to seek us out. I'll just say us. I'm always saying other facilities, you might not be in our area, and that's fine too. So, but I will. I'll just say us. If you are continually taking or giving Advil, ibuprofen, Tylenol to manage pain, and because that's what you're doing. You're trying to manage pain. You're not fixing the injury, which I think most people know. So I'm not attacking that. But if you find yourself giving or taking those things, and those things being passed around or always being asked for, there is something else going on underlying. If you are looking at, okay, yes, brace is not preventative. It's like, well, he's never had an ankle injury before. This is even more dangerous. He's never had an ankle injury before. He's never had a knee injury before. He's never had elbow tendonitis, but we're going to put the strap thing here. We're going to put the strap thing here, and we're going to put braces on the ankle just as preventative. That can alter the biomechanics and the proprioception and the neurological pathways of there is something else on my foot. You're going to shut down other things. There's all kinds of nerdy neurological things that we can take you through that makes them more susceptible, especially long-term. The longer they wear it preventatively, the more chinks in the armor you're going to have.
I'll be the first to say I was the guy that was wearing two ankle braces on the basketball court.
I had the Mueller tie up.
Same ones.
Yep.
And my grandpa just showed me the one that he got from his doc, and it's the same one I used to wear at basketball. I was like, oh, I know these guys. But I got out of them and I implemented the program that we're implementing a lot with our athletes, and never looked back, never had another ankle sprain. And because we were able to strengthen and gain proprioception back and all that stuff that we talked about, I never had to rely on braces again.
And it's if you don't know where to go, if you're struggling with, man, we need to get this checked out and I don't know where to go, and if the only resort is maybe more the traditional route, reach out to us, like call us and just have a conversation with us. Like most of the time, it's like, I tell people all the time, give out my number. I'm not unreachable. There's sometimes I kind of question why I did that, but I would say almost everybody has been great and gracious. And if they do text me, we know it's a serious deal. But same thing goes for if you know somebody who knows us, you want to talk to us directly. If you haven't checked out thepureathlete.com, like you can reach us on there. If you haven't seen our social medias, you can DM us there. We try to be as active as possible on it. But if that's your approach, is like, man, we need to probably go get this checked out, but we don't know where to go, that already means you don't want to go where you're going to end up going. So let us help you find somebody. And if that's us, great. Or let's have a conversation, because we've also told people like, this is a bigger deal. You need to go there. So if that's a part of your checklist, if that's in part of what you're going down, is okay, all this ibuprofen, Tylenol, that's not really helping. We've got all these preventative braces, and we've got a bionic athlete now that's walking out the door. We've got, $1,000 in sport equipment, and we've got $2,000 in preventative equipment. Okay, well, we need to look at that a little differently too. If you don't know where to go, okay, well, that's another check mark. Reach out. There's resources, there's answers that we could provide, but get an evaluation done that is really 4 or 5 dimensional. And if we can be that for you, let's do that. There's so many tools in the basket, and sometimes we just neglect to use them, period. Mm-hmm. So it's just like, there is no stupid questions when it comes to this. It is not a point of weakness to not know where you should have gone. It is not a point of weakness to be like, oh, I don't want them to know my kid is hurt. I've heard that too. It's like, man, I just don't want them to know they're hurt. We're coming into this crucial time. It's like, okay, let us hide that for you. Let us give you answers before anybody else knows or smokes it over, or the performance decides to decrease to where it's like, whether he's hurt or not, he's benched. Like, that's no fun either. But there's a lot of misnomers out there. There's a lot of changing data. I don't think the exposure of that changed data has made it to the top of, well, I know it hasn't made it to the top of the list yet. And so this is exactly why we do what we do. Let us bring them back faster. Let us protect them sooner. Let us be a resource for you. If I can continue to put out more content, if we can continue to do this and build some things that we have in the background, it's like our hope is to be like, this is the standard of care going forward. And maybe in our own little way, we'll have a little ripple in the effect of the changing data and protocols and strategies of how do we protect and build student athletes better.
Yeah, definitely. Your recovery does not have to be a waiting game.
No, not at all. No, watch and wait is not the answer you want, not the answer you should take. So anything else?
No.
Sam? No? All right. So there's a little insight into how we're able to bring student athletes back faster. Pretty foundational, but I think there's a lot of good nuggets in there. If you have any questions, reach out, shoot us a comment, shoot us a DM, whatever it is we need to do. But these kids deserve athlete care like the pros, and you parents deserve to know where to go and who to trust and how to prevent these things. So stay tuned next time on the Pure Playbook by the Pure Athlete. How about that? Stay tuned next time for the Pure Playbook. See ya.